Well, Laura, just when we thought we didn't have to talk about COVID any longer, COVID pops up with a new variant. But do we need to worry about this one? Senior health correspondent Monica Robbins joining us now to break it all down. Monica, good afternoon to you. So what are they calling this new variant?
Oh, you know, they always have nicknames. And Jay, you and I both know COVID is not going away. Many doctors have said it's likely going to turn into something similar to the common cold. And this new one floating around is a subvariant of Omicron, EG.5, nicknamed Eris. The CDC says it's the most dominant strain in the U.S. In Ohio, reported cases made a slight rise, but nowhere near what we've seen before. And they haven't listed variants since mid-July. Now, as kids head back to school in the fall, as usual, we can expect more cases, but it might be difficult to know whether or not it's a cold or COVID because fewer people are bothering with the COVID test because they're no longer free. What hasn't changed for some, though, are the lingering symptoms.
To be honest with you, patients are still showing up with long COVID. They are not necessarily getting sick enough to be hospitalized or necessarily even have to stay off work for a long time, but they're showing up with symptoms that have been persisting for weeks, months, and now years.
So the NIH is launching clinical trials to study some potential treatments for long COVID. So if you are being treated at a COVID clinic at one of our local hospitals, ask your provider for more information about what may be available to you and if you can get in one of the trials. One of the medications they're likely going to be studying is Paxlovid. And while most of us will just be uncomfortable if infected, those with compromised immunity may have it worse, but it doesn't appear Eris is causing any more severe disease. And hospitalization rates around here and around the world are dropping, Jay.
All right, so then there's the question of the vaccines, because I know for many, their vaccines have run out. Do we need to get vaccinated against this COVID variant?
So Dr. England says there will be an updated shot that covers likely Eris expected in the fall. So what you need to do is consider your risk and talk to your healthcare provider. You can get COVID and influenza vaccines at the same time. And if you're over age 60, you can add a third, that new RSV vaccine, at the same time, too, if you can tolerate 3 needles at a time, Jay.
I know for some that is an issue. Monica, as always, great info, and I'm sure you'll keep us posted. Sure. Thanks.